Switching jobs in the middle of a pandemic can be stressful, especially if you aren't sure how it's going to affect your health insurance coverage. Joining us to talk about such health insurance items is a man who knows all about it. It's Craig Gussin from Auerbach and Gussin Insurance and Financial Services. Good morning, Craig. How are you doing today?
I'm doing good, Paul. How you doing?
I am well, sir. For those who are going to have to contemplate a job switch, either because their job is no longer going to be there or they feel this is the time to make a career path alteration, what do you say should be at the top of their concern list?
Well, the first thing you want to look at is, what do you have right now regarding insurance? What's your doctor visit cost you? Do you have a deductible if you're hospitalized? Or have an outpatient surgery? What's the most you pay out of pocket if something major happens? You want to look at how much does your employer pay toward your health insurance? Because if you pay it through your employer, you're paying with pre-tax dollars versus paying it out of your pocket, which is after tax. You want to look at all that. And then once you do that, if you happen to find a job that you may want to go to, because right now there's a lot of job openings. I mean, across the country, and with people being laid off, furloughed, people are thinking, now might be like you mentioned, a great time to maybe look at changing my career. A lot of people in the retail business, restaurants, bars, they're all considering, this is going to go on for a while and I need to start working full time again. So examine your current plan. Say, here's what I got right now. If you're not really sure, talk to your health insurance agent. Talk to the agent that takes care of the health insurance for your company. Determine what are your needs that you need. Are you a diabetic? Do you have any health issues that you really need to make sure you have a doctor in the network and you can see this doctor? And also, what can you afford? I mean, I had a client who called me up and said, I got this great job offer and I'm going to make it like another $5,000, $6,000 a year. But the employer did not offer health insurance. So when they got all done figuring out how much it would cost them for health insurance, because it's after tax versus pre-tax, there was no savings. So it wasn't worth the change, and this person was working full time. So you want to look at your budget. What can you afford? You want to find out from the new employer what kind of health insurance they offer. You may like Kaiser, but this plan doesn't have Kaiser. You may like Sharp. There's plans out there that can offer Sharp, Kaiser, Scripps, PPO, HMO, all in one, so it gives the employer and employee options. So you want to check out what's the plan available for you. Is it going to work for you? What's it going to cost you? How much is the employer contributing towards it? And then the last thing is, well, what happens if it doesn't work out, this job? Well, if it doesn't work out, you're probably going to end up on unemployment. You're going to get the extra $400 a week. And based on that, we can put you in covered California and get you a pretty good plan for not a lot of money. So some of it's, a lot of it's going to be your homework, making sure if you're going to change jobs, is this really the right job for you? What are they going to pay you? And is it really going to work for you as a compo to what you're getting? So that's really the things that we look at right now.
So, I mean, it's nothing new here. Sometimes the best salary is not always the best option, is I think what you're saying, right?
Yep, that's exactly it.
And so for people who want to talk health insurance with somebody, I suspect that's kind of what you do in your business, correct?
That's what we do all the time. I sometimes feel like I'm a therapist because I walk them through. They call me up and they're all upset, and I go, what's the matter? And I got to have a procedure done and all this. So I walk them through it, and I say, okay, what is it you're trying to do? And they tell me, and I'm outside looking in, so it's easy for me to see that, where they're inside trying to figure out how to do it. So insurance agents that deal with health insurance on a daily basis, and anybody that belongs to the San Diego Association of Health Underwriters is going to be that. We can walk you through it and say, okay, what is your concern? What are your issues? And then we can walk them through exactly how you can navigate the system so maybe it doesn't cost you as much. Is it going to be an inpatient surgery versus an outpatient? Because a lot of plans don't have a deductible for an outpatient surgery, only for an inpatient. So if you can go home that day, that might save you money. How much have you used already this year? So a lot of it is just getting information from them and helping them decide what's best for them. and give them options, and that's what we're here to do.
There's so many factors involved, your own health, the health of your family members, and then it's the job opportunity. Sometimes you have to roll the dice because you think that job might parlay into something even bigger with better health benefits, and do you take the risk? As an insurance guy, how do you advise people in those situations where it's a roll of the dice? They want to explore this opportunity because it might lead to something bigger. But it means being under without the protection that they might otherwise have.
Right. What we do is we look at, if it's a single person, when I was young, I decided, graduated college and wanted to get out of cold weather in Michigan, so I moved to California. Being single and doing it is one thing, but having a family, you're right, that's a big difference. And I think one of the things you need to look at is, okay, if I'm married, is my wife working? Can we afford to live on one income for a while? What does her benefits look like? Can we add maybe the whole family to her plan? And that's one of the things I always look at is, okay, if you're married, you want to get the husband and wife both involved in it. What does her benefits look like? Maybe we can add everybody to her plan. It's not going to be that expensive. Maybe we can put you on the new group plan and put the kids on the wife's plan, because that's going to be cheaper than doing it all with one person, because each company is going to pay so much toward the employee's health insurance. So sometimes we split, the spouses. We run into situations where certain kids have a health issue and they need to be able to see a certain doctor. So it's really designing what's going to work for them. So what we do is ask a lot of questions. And through those questions that we're asking, we're starting to get answers. And then we can, based on our education and knowledge, we can say to them, here's what we did, here's what we've done in the past, and here's why it might not be a bad idea. And if you're looking to change jobs, you have to look at it and say, just like you said, Paul, look at the big picture. Is it worth it? What do you got to lose? And I think you're seeing it a lot right now. We recently just hired 2 people who've been looking for a job, and one was in retail and just said, I'm done with retail. So a lot of it is looking at what's going on right now with COVID-19 and saying, okay, is this a job that will be there for me regardless of what happens in any kind of pandemic? So, and a lot of people are just ready for a change. Mm-hmm. I think you probably hear that from friends of yours, Paul. It's like, I've been doing this for 20 years. I'm ready for a change. So you just do that. As long as the family is on board, I think it's a great way of going. But
Craig,
you got to be willing to take that risk. And if you are, great. If not, then you need to think about what's best for the family.
You're preaching to the choir, Craig. I can relate to wanting to change after 20 some odd years. All right, we will take your advice. We'll post all your information up on our social media for people who want to watch this conversation again. Craig Gussin, everybody, thank you very much for your insight, Craig.